Hey, everybody, and welcome to the Strategic Edge. Today, I have my guest, Evan Silverman from Precision Advisory. We'll just be discussing his journey, his transition to running his own business, and I hope you guys enjoy. So, Evan, thank you so much for joining me today. I have to say, when I was preparing for this conversation, what struck me the most wasn't just your impressive track record in finance, but also creating verticals that became category leaders, overseeing 500 million in revenue. But the fact that you walked away from all of that to focus specifically on behavioral health, that's not a move someone makes unless something deep is pulling them to it. So what was your moment of realization that made you think this is where I need to focus my expertise?
Yeah, absolutely. And it's great to be here. So I'll give you a little background and context before I tell you why I ended up making that move. I started my career in consulting for banks and then moved to NBC and then fluent in strategy and finance positions. I've had much more of a corporate background and was rising up the corporate ladder and is really enjoying my time there. But my family's background is in behavioral health. My grandfather was a pioneer in methadone maintenance treatment and opened up one of the first methadone facilities in New York in the 1970s. And my family, my mom, my aunt, and my cousins currently operate that same facility and have become advocates for public policy in the space as well. So it's an area that I've grown up around and have a deep passion for. So, earlier this year, as I was trying to figure out what the next steps in my own career were, I thought it made more sense, honestly, to go off on my own and explore marrying my professional background in finance and strategy with the passion of behavioral health. And it's been extremely exciting so far to grow this business from the ground up and,
Hmm.
help facilities that are doing really incredible work in our society. And I feel much more connected to the financial strategies that I'm giving my stakeholders at this point in my career.
That's fantastic, especially since you look so young. You started Precision Advisory around January 20 of this year, and you're about 9 months into this entrepreneurial journey. So something that I would like to ask you is what's been the reality versus expectation for you?
It's a great question. And I think that when you start an entrepreneurial journey, specifically coming from a corporate background, I guess
Mm-hmm.
everyone tells you about the lack of structure and the unknown. But I think until you really are 2 feet in, it's hard to appreciate what that actually looks like. And, I started out expecting, great, I'm here, the world is going to accept me, and they're all just going to start rolling out the red carpet and hiring me
Mm-hmm.
as that's the structure that I've been used to in the corporate setting. You typically show up to your office every day. There's
Yeah.
clearly very defined work. There's defined teams. There's defined personnel, and when you complete that work, it's very easy. Not very easy, but it's easier to stand out because you're much
Mm-hmm.
more over what the area is. When you're doing the entrepreneurial work, there's no clear market, there's no clear product, there's no clear client base, and you have to really define a lot of that. So once I started,
Yeah.
I realized I had to, first of all, understand what the industry specifically needs. What is the real need within the industry? And then how do I position myself strategically within that industry that will get clients?
Mm-hmm.
And being able to not only just have that service that will generate interest, but also to get in
Yeah.
front of people in an effective way that will make them want to hire you. So it's an interesting process to to have to continue refining exactly what you're offering and making sure
Mm-hmm.
figuring out kind of I'm heading in this direction. I think it's the right way. Is it the correct decision? There doesn't seem to be traction here. Do I pivot? Do I keep moving forward? So continuing making those decisions is a challenging part of the entrepreneurial work that I don't know if I fully appreciated getting into, but at this point, it's actually one of the more exciting parts because you have the flexibility to continue adapting as you learn more about your clients.
True. And also, you've spoken about clients. So, like, How would you describe your approach as moving clients from complexity to clarity? Like, I love the framing because behavioral health organizations are drowning in complexity right now, like with multiple funding streams, different regulations, clinical protocols. So, when a potential client comes to you, what's typically the complexity they're wrestling with that makes them raise their hand and say, "We need help"?
Yeah, it's a good question. And I think it's one of the things that I'm still working through is within the behavioral health space, there are a lot of different types of issues depending on the geography, the different types of services they're offering. Specifically, I've been focusing on opioid treatment providers in New York. That's where my family's based, and that's what I've been focusing on. So one of the things that I did was research the area and understood what the major challenges they're facing are. And a lot of them are dealing with material patient decline year over year. They don't really know where they have kind of oversaturated the number of providers in the space, and they are seeing kind of a depressed number of patients that are entering their facilities each year, and they don't really know what to do about that. So, in terms of to answer your question more specifically, a lot of these
Yeah.
providers are dealing with more the day to day of providing medical treatment for their patients. What I'm offering though is kind of the higher level strategy for how to position their business to make sure that they're able to be successful in the long run. That usually come a lot of them have EMR systems that have a lot of complicated data, or they have complicated
Mm-hmm.
billing structures that they kind of know really the bare minimum to be able to kind of get their stuff accomplished, but they don't necessarily know how to analyze the data and put it into a format that will allow them to make those types of decisions. So what I do is I come into a facility, take large data sets,
Mm-hmm.
and not only just kind of put it into reports, but also into actionable roadmaps for them to help them make those types of decisions. Over the course of the year, I've helped my clients with A transactions to figure out when it was the right time to make an acquisition. I've helped with
Mm-hmm.
succession planning to figure out, when they've had doctors that have been kind of maintaining the bulk of the revenue source for a business, how to transition that to
Mm-hmm.
maybe to bring on to a new medical director. I've
Yeah.
also helped install a revenue. It's kind of blanking to me, but figuring out basically how to improve their collections and
Mm-hmm.
decrease their uncollectible rate so they can track the life cycle of their claims as they are processing them. And I've also helped with managing the unit economics of a business so they can understand which services they need to be prioritizing as
Mm-hmm.
they try to grow their business.
So the way you've mentioned how you've been helping all the various clients with a lot of various things. So I've been reading about AI and automation showing promise in clinical documentation or care delivery or even managing data. So from your vantage point, like with working with multiple clients, what's the gap between the innovation everyone's talking about right now, which is AI, and what's actually getting implemented on the ground?
Yeah, I mean, I would approach that in 2 ways. I think from a finance strategy perspective, that industry will be definitely impacted by AI in the near future. I leverage AI a lot in terms of, assisting my clients. It allows me to take a whole different level of, speed and analysis by, being able to leverage AI to do my work better, and I'm aware
Mhm.
that AI will eventually become, capable of doing some of this stuff without me as well. From a finance
Yeah.
and strategy perspective, AI is gonna be very disruptive and, will
Mhm.
impact that industry. From a behavioral health perspective, there is definitely opportunity for AI to also improve this area. It is not an industry,
Mhm.
though, that has much of an appetite for large technological changes, though, and
Mhm.
they have been slow moving for a lot of different in a lot of different tech advancements, and mostly that's
Mhm.
because it hasn't been mission critical to update based on modern technology. There are a lot of
Mhm.
behavioral health facilities that are operating the same way they were in the 80s, and that's
Yeah.
mostly because if you are still able to help your patients, there isn't much of a market need to push them to accept that technology. AI will eventually. to this space as well. But I would imagine this is one of the spaces that will get to quite late. It will affect other industries well before this one, and when it does affect the industry, it will be more likely as copying other ones, seeing that there is so much opportunity there that it's obvious that they should adapt it, as opposed to it, being one of the
Yeah.
first ones adapted by AI.
Yeah. So there's something I've been thinking about, and I'd love your take on this. So, like you said, a lot of industries have already started um adapting AI, and now the new playbook for success nowadays is standardize, automate, and build systems. But in behavioral health, you're dealing with human outcomes that genuinely need that personal touch. So I
Exactly.
imagine the organizations you work with are constantly trying to wrestle with this balance. So how do we grow sustainably without losing the quality care that defines us? Like, how are you helping them thread that needle?
Yeah, look, I mean, I think that given exactly what you said, given the necessity for the human touch, I think the industry will naturally make this adjustment as needed. There are certain tasks that can be automated through telehealth is one of them, that you don't need your patients to come into the office into the clinic every single day, be able to engage with
Yeah.
them, and you can engage with a larger scope of patients when you are using technology to interact with them. How
Mhm.
you track notes, it used to be done, pen and paper, and there's
Yeah.
obviously a lot of systems to do that now.
Mhm.
But at the end of the day, similarly, when any of us go to the doctor, there is
Mhm.
a human to human element that we all crave when we're dealing with some of our more personal information. And this is, even though you're dealing with essential services that people need treatment, there are a lot
Mhm.
of options. There is no reason why someone is required to be in one facility over another, unless it's mandated by because of the court. They
Mhm.
usually can pick and choose where they want to get their treatment. So if you're not
Yeah.
providing care that your patients desire, then they will just find the place that can do it. So I guess my point is there will be there'll be natural tech advancements that make sense for the businesses. Some of them will
Mhm.
overreach, will pay the consequences because of that, and then
Yeah.
and then some of them will be effective while they're doing it. But there's ways that they're automating take-home prescriptions that can maybe decrease the impact of how much nurses need to be used in these spaces. There will be tech
Mhm.
advance. I think that the industry is a bit of an inflection point that making the right tech advancements at this point will determine which facilities are able to be more successful than others. But again, they're gonna take a slow. I would be. It's just knowing this industry in particular. It's hard to
Mhm.
imagine that there be many fast movers.
Okay, because the behavioral health consulting space nowadays is kind of crowded. Like traditional healthcare consultants, tech companies promising software solutions, private equity backed firms doing roll ups. Like when you're in a conversation with a potential client, what do you what do they tell you they're looking for that they're not finding elsewhere?
I think it's an interesting question because specifically what I'm offering does not.
Yeah,
I don't have clients who are calling me. I have to be the one convincing them that these are
calling
the
them.
services that they need. And a lot of them understand that they need a, um, you know, uh, they I focus on clients that are under $25 million in revenue,
Mhm.
and
Mhm.
a lot of them are, have a CEO. Maybe they have
Yeah.
someone who's kind of operating as a CFO to a degree, but
Mhm.
they have a staff. They have doctors and PAs and nurses on staff, and they tend to they have their services, but they don't fully have the capacity to fully analyze their position within the market, to understand how to
Yeah.
best use the resources to make sure that they are, if they're for profit, able to maximize their profit, or if they're not for profit, to be expand their services and then their reach. And that's something they tend to have a lot of trouble with. Now, what I have to do is to understand what their issues are, and every prospective client comes in with their own
Yeah.
issues, and
Yeah.
I have to show them what the financial impact is for not moving and not changing what they have to do. And typically, you're talking in the hundreds of thousands of dollars by with inaction, or potentially
Yeah.
the risk of losing the practice altogether. And when I show them and I show them the opportunity of what it would look like to optimize certain areas of their business, they tend to
Mhm.
understand that that's an incredible opportunity, and this is something they do need to invest in. There is a
Yeah.
very crowded space in terms of, I would say, in terms of general consultants and vendors that support these types of clinics. But the type of work
Mhm.
that I'm offering is not as established yet, and there is definitely a gap within this market that I've kind of been able to take advantage of. That people are looking for this type of financial and strategic support, that
Yeah.
their accountants are, helping them to a degree, but not necessarily helping them get that strategy component.
Okay. So I want to come and start discussing your business model and your growth so far. So, talk me through how you've structured precision advisory. Are you doing project based engagements, retainer relationships, fractional CFO work? I'm curious how you've designed this to be sustainable for you while delivering the depth of strategic partnership that you talk about.
Yeah, it's a great question, and it's a question that if you have the answer to, I'm happy to hear as well. That's part of I think that it's an important part of, early entrepreneurial work, and it's important to be
Yes,
open-minded about and be flexible about how to position yourself. Within this
very true.
year, I've changed my structure from hourly to project-based to a lot of
Mm-hmm.
different ways, and it's had to do much more with, again, the specific clients that I'm working with, understanding what
Yeah,
their needs are, and kind of being a little bit like Play-Doh, and trying to fit the exact space that I can within that client's need. I think as you continue doing that, it becomes more clear what the model looks like. But the risk is coming in too rigid and saying this is exactly what I need to do, and then and then scaring away people just based because that's not their specific need.
yeah,
I've gotten a lot of different advice from people who felt very strongly about certain models, that whether that's, "Oh, you need to make sure it's hourly, you need to make sure it's this rate," and then some of them that were
yeah.
more, "Oh, you need to make sure it's project based." I've done
Mm-hmm.
effectively a quasi combination of it to give myself that, flexibility. So I
Yeah.
have usually charged per hour, but it's
Mm-hmm.
for an estimated amount what this project will look like. Typically go well over those hours. It is more project based, but what that allows me to do is
Mm-hmm.
typically when you finish an engagement, there is almost
Yeah.
always opportunity for further help that they will need. And now you've at least established a benchmark for what future work will look like and how much that will cost them. So if they know you cost
Yeah.
this much per hour, you may have finished this project and now they need you to do more work. Now you've kind of
Mm-hmm.
allowed yourself to easily transition to the next project.
That's great because a lot of businesses nowadays, they don't know what to even charge clients, or they even undervalue themselves while they're doing those projects.
But it's important though to, and I kind of said sustainably,
Yeah.
I think that in the year here, I have undervalued my labor slightly because
Mm-hmm.
I'm trying to establish a footprint in the area. And I
Yeah.
think that once
Yeah.
you have established yourself as the go-to person for a specific service, you can then
Mm-hmm.
charge more as time goes on. But,
True.
in all transparency, I have a lot of value I'm providing my clients, but there's still a lot of
Mm-hmm.
learning that I need to do to make sure that I'm the best consultant for them that I can be. And
True.
there is a little bit of a discount that I basically am giving as my own learning process to get to to get that opportunity.
Very true. And that's fantastic. I mean, being an entrepreneur is not easy at all. You're always learning every day. And the fact that you've mentioned that right now you're trying to get value from to show value to your clients and everything. Are you building precision advisory currently as a solo practice right now, or have you brought on team members? I ask this because there's always this interesting inflection point where demand outpaces what one person can handle, and you have to decide, do I turn the work away? Do I bring on more people? Do I raise prices? Like, where are you in that evaluation?
No, it's a great question. And I think that I'm definitely getting close to that point where the bandwidth for as an individual start it becomes harder, and that I would say my next step would be to bring someone else on. I haven't fully explored in what capacity that would look like. I would imagine it would be some sort of it would probably be someone that I know that would be willing
Yeah.
to do it, needed to kind of help me fill the
Mm-hmm.
gap. And as I can learn a little bit about what that, bringing on a full time hire would look like. What that would allow me to do if I had that ability would free me up to focus primarily on business development and grow the business a lot faster. But it's not where precision advisory is today. But I think if
Yeah.
we talked in a few months, that's definitely something that I'm going to have to start considering.
And as you're building out your business and your client base, these first 9 months, like what's the sweet spot you're finding in terms of organizational size or stage?
Yeah, stage of the business can be a variety of can be anything. I've dealt with very mature businesses to new ones,
Mm-hmm.
but size is typically under 25 million in revenue. And why
Yeah.
that is once you start getting above that, you start dealing with practices that might have an in-house CFO or
Mm-hmm.
finance team. And
Mm-hmm.
25 is actually a bit high. You're really looking at under 10 million in revenue. That's been more my sweet spot where
Mm-hmm.
there's more interest because you're usually looking at someone, also usually an entrepreneur who is or maybe a doctor who's passionate about the space, who has, need to who is operating a facility but needs, again, not a full-time finance support, but someone who is going to help them answer key questions about their business that they can, continue focusing on the parts of their industry that they need to, but they can have
Mm-hmm.
the information that they need to make those types of decisions. So I'd say it's more size of the business than stage of the business.
That's very interesting because I find that organizations that get the most value from strategic consulting are the ones who've reached a point where their cost of not solving their problem exceeds the investment. So, when you're talking to behavioral health leaders, what's typically the tipping point that makes them decide to invest in strategic financial advisory? Is it a funding opportunity, operational chaos that's costing them, preparation for scale? Like, what gets them over the line from we should probably do this to we need to do this now?
Yeah, it tends to be a specific issue that they're dealing with in their business. They know that something is either bleeding or they know it's causing a lot of operational headache. They don't
Mm-hmm.
usually know the extent of that or what the impact actually is to their business, but they're aware
Mm-hmm.
that a lot of their time is spent on a specific issue that doesn't seem to be getting solved and maybe even getting worse over time. It is a slow moving industry though. Say these are typically something it's rarely that someone looks at their business and says, "This has been a bad month. We need someone to come in." I'm usually looking at
Yeah.
clients that have been experiencing an issue over 3 years and they're like, "We just
Mm-hmm.
can't figure out how to make something work." And,
Mm-hmm.
I have conversations with them and I figure out what those situations are and I help them understand kind of, yes, that's I help I resonate with them on the issues that they're dealing with. And then
Yeah.
I present solutions for, it doesn't need to be this bad and we can solve this together and
Mm-hmm.
this is going to get you to this place in your business that you're looking to get to. Um,
Mm-hmm.
yeah, so I think that's it's rarely, again, there are certain services that are um that are easier to sell in some ways. Again, if you're an accountant, everyone is going
Mm-hmm.
to need accountant to for their taxes and
True.
close their books. If you're a
Mm-hmm.
lawyer, people are going to need the legal advice. They know they need a lawyer for certain things.
Mm-hmm.
This that I'm doing ends up being much more specific to each client and the issues that they're dealing with. So again, it's just being able to listen to those issues and presenting the specific solutions that's going to help them.
So if we were having a conversation a year from now, it's October 2026, and you're telling me about the best year precision advisory has had, like, what does that look like for you? What would you have to be true for you to feel like Yes, this is exactly how I envisioned this.
Yeah, it's a great question. And again, I think it would be to that point, it would be to scale to the level that I do have other hires on this team that I'm not operating myself, because there is a clear ceiling of how large this can be if I'm the only one working on it. I think that I would have a team of people that are managing the specific financial and operational strategy for the clients. I would be overseeing that and helping with the client relationships and making sure that the final deliverables are understood. And then I would be
Yeah,
focusing on not only just business development, but also advocacy and speaking engagements in this space. One of the ways that I have been able to get to know or to get to meet clients has been to have speaking engagements and speak about the issues in this industry. I've spoken about some of the cuts to Medicaid and how that's going to impact this industry. And I think that
yeah,
that's being able to use, I have an economics background and understand kind of how large shocks to, macroeconomic shocks will affect individual facilities. I think is something that
uh-huh,
I have a specific lens into and can really speak to. So I think that I would like Precision Advisory to not only be a consulting business, but something that is a real player in the space and can be seen as an
uh-huh.
expert in terms of understanding what the future of the industry is going to look like.
Like you've said that you wanna be seen more than a consulting firm. You want to be in this space of this business where you can represent yourselves really well. So if you could wave a magic wand and solve some of the bottlenecks right now, like your biggest bottlenecks right now, what would that look like for you?
For Precision Advisory,
Yes, yes, for precision advisory.
yeah, I would say, I mean, I would, if I could wave a magic wand, I would unlock the client pipeline. It's a siloed industry that getting in front of people at scale is a challenge. And this is one of the reasons that I've been able to get into this industry is because of, my family's connection and connection in the space. So I've been able to get speaking engagements and get in front of prospective clients.
Yeah.
But I would like to grow across the country and, within a variety of areas within the space. There's a lot of different opportunities here, and being able to get in front of as many prospective clients as possible would be the way to
Uh-huh.
grow this. I'm very confident
Uh-huh.
with what we're offering and the need it has in the industry. The bottleneck is to just get it, to
Got
present it in front of
clients.
enough people.
Yeah, so from what I'm hearing is that you've been using like you've been going to speaking conferences and getting engagements, but getting more clients, like lead generation basically, is what you want to kind of solve as you go on throughout the year as well as starting next year. So, my question for you is looking ahead to the next 2 to 3 years, what do you think is going to be the biggest shift that organizations need to prepare for, whether it's regulatory, technological, in how care is delivered, funding models? Like, what's the change you're telling clients they need to get ahead of?
Yeah, it's very clear in this space. It's the Medicaid cuts. This is a not only in behavioral health, but across the health and medicine space. This is going to be a seismic shift in this industry. From behavioral health in particular, there are a lot of Medicaid assistant patients within this space. When you're dealing with the types of cuts that we are looking at, each state will have their own impact, but you're looking at a lot of people getting knocked off of their insurance, which will make patient looking at from a specific facility perspective, you're looking at each facility losing their patient volume, which will be really problematic, and you're looking at funding losses. So if you're not for profit and you are relying on state funding, there a lot of those grants are going to dry up, and there's going to be a lot less money within this ecosystem. And
Yeah,
typically, in any market, when the pie gets smaller, the weakest players will be the ones that feel the biggest impact. So if you are
true.
looking at less money within the space in general, the primary people that
Uh-huh.
will be impacted are the patients, and the patients will receive less quality care, and fewer of them will be able
Yeah.
to access care. That's disastrous and terrible for our society. The second
Uh-huh.
one will the facilities that the individual providers that are that are relying that don't also have that much power in the space and are receiving their funding usually through insurance payers. The payers are the ones that are not going. They will also face a bit of squeeze with these cuts, but
Yeah.
they have the power to deal less with it, and they are going to increase their denials and squeeze the providers harder, making funding less for these providers. So it
Mm-hmm.
will become much harder for smaller practices to exist in the future if there's a contraction within the behavioral health space.
Very true. Especially the with the federal shutdown that happened last week. You have this unique vantage point, especially since you have a finance background and now you're working with multiple behavioral organizations. That's prime position for thought leadership. So are you thinking about creating content? I mean, you've mentioned you want to speak in more engagements. So how are you building a platform around what you're learning and what you can provide?
Yeah, look, I mean, a lot of what I am able to learn is through my client engagement and again through the connections that I have within this industry that I can continue talking to people and learning more. But it's being able to get my own voice out there and my perspective is really what I'm focused on right now. And a lot of that is going to be through speaking engagements. And, I'm also working on writing articles for certain publications as well, doing podcasts like this. And it's really just
Yeah.
trying to get as much exposure as I possibly can to,
Mhm.
to get people to know Precision Advisory and Evan Silverman as much as we can.
That's fantastic. I want to bring this full circle because we've given a lot of our time in our discussion. It's been an amazing discussion. So you left a comfortable, successful corporate career to do this work. And I know it must have not been easy. So now that you're 9 months in and in the thick of it, especially now it's Q4, the year is about to end. What keeps you energized? What makes you think, yeah, this is exactly what I'm supposed to be doing?
I don't think getting to that level of comfort is what you sign up for when you're doing
Uh-huh.
entrepreneurial work. I don't think that's realistic, specifically in the beginning here.
Uh-huh.
I think that there are lots of highs and lows in this space, and within this year, I've gone through weeks, months that I have been going to sleep with a big smile on my face thinking this is the best opportunity. I'm so happy to be in this. This is going to be, multi-million dollar idea. And then I
Uh-huh.
have I say to myself, what the hell am I doing? This is ridiculous. And like, are people going to be interested? And I think I couldn't be happier with the decision to do this. First of all, I have the technical skill set and the relationships that this jump made sense for me, but
Uh-huh.
that does not make it, a smooth ride to get to where I'm trying to go to. And I think that being able to ride the waves as they come is really the key here. Right
Yeah.
now I have a lot of client activity and a lot of excitement over the next few months to where I want to go. But, I look at my
Uh-huh.
calendar and I look at the springtime of next year and there's nothing on there. So you have to then deal
Yeah.
with the concern that okay, by that time, am I going to have more clients? Am I going to have enough time to prioritize business development to get to that point? I think at this point, I get more and more confidence as time goes on that there will be
Yeah.
clients that I can spend my time with, but that's not a
Uh-huh.
given. And I think that, I think being able to have um, just continuing to push through, having confidence in what I have to offer is the
Uh-huh.
key here. I think that I'm very, very happy to have taken this jump, and I'm happy with what I've even accomplished within this first year here, and I'm extremely excited
Yeah.
about what future looks like. But I'm also aware within that future there is going to be a lot of waves that I'm going to have to continue to ride, and I'm excited for the journey.
And that's crazy because entrepreneurship isn't easy. It's all about ups and downs and just riding the wave and keeping your head up. So for the people who are listening, who are either in behavioral health or thinking about making a similar transition, What's the one piece of advice you'd want to leave them with?
You're saying which people am I referring to here?
For the people who listen to the podcast.
Okay. Yeah, I mean, look, I think that if you're looking to make an entrepreneurial jump, I think you have to. I think what I did was definitely a bit aggressive to leave my job and do this. I
Mhm,
think that I've had some luck to make sure that this has been as successful in the first year as it has. So I think trying to get as much of your footing as you can before you have to make that financial leap within your own life is a good thing. And I think you got to be able to have confidence in yourself and confidence that this is going to be successful. There is no written path. Is not going to be clear day in, day out, what it's going to look like. And you have to feel like you did the groundwork to understand that you're in the right industry, that you've positioned yourself correctly, and then continue being flexible to adjust to that. It's the advice that I would give is just be patient, but also be diligent to make sure that you are adjusting as needed. And if you do that and you're in the right space, it will eventually work out. There is a journey to get to that part of it where you need to go.
Evan, thank you so much. This has been a valuable conversation. Just wondering, where can people find you and Precision Advisory, and what's the best way for someone to reach out to you if they want to continue a conversation
Yeah,
with you?
this has been a great conversation. I'm happy to be your first guest here, and they can
Thank you.
reach me on my website at precisionadvisoryco.com, and you can
Mhm.
schedule a consultation with me, whether it's as a prospective client or just looking to have a conversation. I love to speak to people and learn about their experience and talk about my own. So I'm open to anyone reaching out, and yeah, this has been really great.
I really appreciate you sharing not just the strategic insights, but the real talk about your entrepreneurial journey. Thank you for making the time. And I will attach the links down below in the description so that you guys can reach out to Evan and also help him in his entrepreneurial journey. Thank you.
So thank you so much.
All right, Evan.